A presentation of the University of Alabama in Birmingham Dental Television System. Dental Anatomy. Pulp Morphology. A telecourse by Dr. Barry Eisenberg and Dr. Michael Hughes. The soft tissue component of the tooth is called the dental pulp. It functions as a source of nutrition, maintenance of the dentin, and additionally provides sensory and defensive functions. The pulp is centrally located within the dentin and roughly reflects the anatomical contours of the dentin and the tooth in general. Components of the dental pulp. The pulp cavity. The dental pulp occupies the space within the dentin, which is called the pulp cavity. The apical foramen. The opening at the end of the root is the apical foramen. This is the portal of entry for the vascular, lymphatic, and nervous supply essential for the vitality of the tooth. The pulp canal. The pulp canal is that portion of the pulp cavity located in the root of the tooth. The pulp chamber. The pulp chamber is that portion of the pulp cavity found primarily within the coronal aspect of the tooth. The pulp horns. There are extensions of the pulp into the roof of the pulp chamber. Often these extensions are multiple. These projections of pulp tissue occupy spaces referred to as pulp horns. These horns correspond in location to cusps or lobes of development. Deviations or anomalies. Deviations from these normal anatomical configurations frequently occur. For example, pulp horns can be extremely large, extremely small, or entirely missing. They are usually most marked in young teeth, becoming smaller or disappearing with age. Frequently, external stimuli or age can cause the entire pulp cavity to become smaller. It is possible for a root to have more than one foramen. If this occurs, they are referred to as multiple foramina. In these cases, the canals have more than one branch and are designated as supplementary canals. The following teeth are representative of basic variations of pulp morphology. The maxillary central incisor, the maxillary canine, the maxillary first premolar, the maxillary first molar, and the mandibular first molar. For purposes of study, the pulp cavities of these teeth will be demonstrated in both longitudinal and transverse sections. Anterior teeth. Maxillary central incisor. The maxillary central incisor will be sectioned and viewed from the following aspects: mesiodistal longitudinal section, labial-lingual longitudinal section, cervical transverse section, mid-root transverse section. From the mesiodistal longitudinal section, pulp horns are frequently observed in the incisal portion. They conform to the labial lobes of development of the crown. The pulp chamber is widest from this view. The pulp canal tapers, gradually becoming smaller as it approaches the apex. A labial-lingual longitudinal section observed from the proximal shows a chamber pointed toward the incisal and increasing in size as the crown dimension increases. At the cervical level, the pulp canal begins to taper, and as it traverses the root, it gradually becomes smaller. A transverse section in the cervical portion of the tooth shows the pulp chamber conforming to the outline of the tooth, that is, somewhat triangular in shape. A mid-root section reveals the same relative relationship. Maxillary canine. The maxillary canine will be sectioned and viewed from the following aspects: mesiodistal longitudinal section, labiolingual longitudinal section, cervical transverse section, mid-root transverse section. In the mesiodistal longitudinal section, only one pulp horn is evident, corresponding to the single large cusp. The shape of the chamber is comparable with other maxillary anterior teeth, but usually narrower than the maxillary central incisor. Its configuration from the pulp chamber to the apex continues as a narrowed tapered cavity. A longitudinal section viewed from the proximal, because of the increased dimension of the tooth labiolingually, will demonstrate a pulp cavity and canal usually wider than other anterior teeth. The cervical cross-section, again, conforms to the outline of the tooth. The mid-root section demonstrates the same relative relationship. Posterior teeth. Maxillary first premolar. The maxillary first premolar is sectioned and viewed from the following aspects: mesiodistal longitudinal section, buccolingual longitudinal section, cervical transverse section, mid-root transverse section. As might be expected from the mesiodistal section, the shape of the pulp cavity is similar to the maxillary canine when the section is made through the buccal cusp and buccal root. From the proximal view, this tooth usually has two well-developed, fully formed roots. Pulp horns are observed in the roof of the chamber corresponding to the two cusps. The pulp chamber is broad and follows the outline of the dentin. Characteristically, the root canals in this tooth have funnel-like openings from the pulp chamber and taper to the apex, conforming to the dentinal outline. The cross-section at the cervical line demonstrates a kidney-shaped pulp outline, corresponding to the characteristic outline in this area of the tooth. The mid-root section has two separate components in which the pulp canals follow the outline of the individual roots. Maxillary first molar. The maxillary first molar is sectioned and viewed from the following aspects: mesiodistal longitudinal section, buccolingual longitudinal section, cervical transverse section, mid-root transverse section. A mesiodistal longitudinal section through the two buccal cusps and corresponding roots reveal two pulp horns, an enlarged pulp chamber, and tapering canals in each of the mesiobuccal and distobuccal roots. The buccolingual section through a buccal root and the palatal root shows a similar pulp cavity configuration. Usually the palatal canal will be larger as the palatal root is dimensionally greater. A transverse section at the cervical will show a pulp cavity outline somewhat rhomboidal, corresponding to the shape of the tooth. The mid-root section will have three separate components in which the pulp canals follow the outline of the individual roots. Mandibular first molar. The mandibular first molar is sectioned and viewed from the following aspects: mesiodistal longitudinal section, buccolingual longitudinal section, cervical transverse section, Mid-root transverse section. The mesiodistal longitudinal section is directed through the buccal cusps and demonstrates pulp horns, chamber, and canals consistent with the shape of the dentin. The buccolingual longitudinal section through the buccal and lingual cusps and surrounding roots will show little variation except in the case of the mesial root. The mesial root may have one broad canal which remains quite wide buccolingually and narrows to a pointed apical foramen. Most mandibular first molars, however, exhibit two separate canals in the mesial root which may join in a common apical foramen or remain separate. The cervical cross-section demonstrates an outline consistent with the outline of the tooth, tapering in the distal aspect from the wider mesial dimension. A mid-root section will have two separate components in which the pulp canals follow the outline of the individual roots. Usually, the mesial root is somewhat kidney-shaped with two canals. This root may show one narrow flat canal, the shape of the root remaining the same. The distal root is rounder than the mesial root and usually presents only one root canal. While no attempt is made to describe each individual pulp cavity and possible anomalies of all the teeth, those that have been presented provide the basic comparative morphologic examples.